In the COVID-19 guidelines for 2021-2022, there are three procedures and processes for students to return to in person school after exposure to COVID. Close contact means that you have had direct contact with a person who has COVID 19 for a cumulative amount of time greater than 15 minutes and less than 6 feet away. Contact of a contact is defined as you have been in contact with someone who has been identified as close contact with a COVID positive person. If you are contact of a contact, you do not need to quarantine. If you develop symptoms of COVID 19, contact your medical provider and get a COVID test. Once students have been notified of COVID contact, either close contact or contact of a contact, there are three procedures that can lead them back to coming back to school. The first is to take a COVID 19 test. If they take the test with a negative result without known COVID exposure, then the student is asked to submit proof of a negative test to the school site and remain home until symptoms have improved and they are fever free for 24 hours without medication use. If a student gets a negative result and has been in close contact with COVID exposure, please follow the quarantine guidelines. If a student gets a positive result, then they must remain at home for at least 10 days. At least 24 hours have passed since the resolution of fever without the use of medication, and other symptoms have improved. If the student does not take a COVID test, then you must remain at home for at least 10 days. At least 24 hours have passed since the resolution of the fever without use of medication, and other symptoms have improved. Post COVID, do not take a COVID 19 test if it has been less than 90 days since you have had COVID 19. You do not need to quarantine if you have been identified as a close contact, if you have had COVID 19 in the past 90 days, or if you are asymptomatic. Documentation of a positive COVID 19 test is required. If you develop any signs of or symptoms of COVID 19, contact your healthcare provider. For attendance and on campus activities, if you are ill, students are advised to not come to campus. For both virtual academy and in person classrooms, students are asked to follow the guidelines. Quarantine guidelines. Quarantine requirements begin with vaccinated close contact students. A fully vaccinated student may not need to quarantine. Students who are vaccinated can follow these processes. If they experience no symptoms of illness, then provide the school with a proof of vaccination. Testing is still recommended 3 to 5 days after close contact. For unvaccinated close contact students, and both parties were wearing a mask. When both parties are wearing a mask in a school setting in which students are supervised by school staff, unvaccinated students who are in close contact may undergo a modified quarantine. They may continue to attend school for in person instruction. If they are asymptomatic, continue to appropriately mask as required, undergo at least twice weekly testing during the 10-day quarantine, and continue to quarantine for all extracurricular activities at school, including sports and activities within the community setting. Finally, for unvaccinated close contacts and one or both people were not wearing a mask, those who have not had any symptoms may end their self quarantine under the following conditions. Quarantine can end after day 10 from the date of last exposure without testing, and the student may return to school. Quarantine can end after day 7 if a negative test is collected and after day 5 from the date of the last exposure. To discontinue quarantine before 10 days following last known exposure, the student must continue daily self monitoring for symptoms, follow all recommended non pharmaceutical interventions. Symptoms should be monitored for 14 days. If any symptoms develop during the 14 days, the exposed person must immediately isolate, get tested, and contact their healthcare provider with any questions.